Good day, professors. We're Group 1 from BSMT1C, and our members are Eliezer John Castro, Rosemary Estrada, Micaela Juco, Guard Angelo Navarro, and Rainiel Luis Nogoy, and we are assigned to discuss the Gaucher disease. The subtopics of our discussions are as follows: introduction about the disease, symptoms, classifications, such as the types of Gaucher disease, pertinent information such as statistics of the disease and treatment of Gaucher disease. Origin: Gaucher disease is a rare genetic disorder that was first described by French physician Philippe Gaucher. So Gaucher disease originates in the process of mutation that occurs in the specific gene known as glucocerebrosidase 1 or simply GBA1, which is located on the first chromosome of the human body, specifically in locus 21 of chromosome 1. Gaucher disease results to a lack of activity of enzyme or the production of the enzyme known as glucocerebrosidase. What is Gaucher disease? As mentioned a while ago, Gaucher disease is characterized by the lack of glucocerebrosidase in the body. Now, glucocerebrosidase is an enzyme that is produced in the smooth endoplasmic reticulum and is then delivered by the Golgi apparatus or Golgi body to the other organelles to perform a specific function. And this function is to catalyze or speed up the phagocytic action of immune cells known as macrophages containing organelles we know as lysosomes. Lysosomes are the digestive center of our cells. Lysosomes in turn will digest worn-out cells that may contain glucocerebrosides. Glucocerebrosides are glycolipids, meaning they compose of both sugar and fats, and they make up the component of the cell membrane. A patient with Gaucher disease would have the failure of producing enough glucocerebrosidase or the lack of activity of glucocerebrosidase, causing the macrophages to still engulf glycolipids. However, their lysosomes are unable to break down these fats or glycolipids into smaller components, causing an accumulation or storage of fats in these cells. These cells then will appear swollen, fatty, or tissue-like, and hence they would be called as Gaucher cells. So Gaucher cells are fatty-appearing macrophages that aggregate or accumulate in the different body tissues and organs, primarily in organs with high concentration of macrophages such as the liver, spleen, and the bone marrow. Though the cause is still unknown, Gaucher cells secrete lysosomal enzymes and inflammatory signals that may cause an immune response and scar tissue production in the body, leading to numerous signs and symptoms experienced by an individual having the Gaucher disease.
For the causes of Gaucher disease, the primary cause of all forms of Gaucher disease is the mutation or changes in the GBA1 or specifically the glucocerebrosidase gene that is found in gene 1. Since the primary cause is mutation, let us know when this occurs. Mutations can occur unprompted and may occur from errors, mostly during DNA replication, exposure to radiation, and or exposure to chemicals in the environment that are highly reactive. Now, let us know what the GBA1 gene is for. The GBA1 gene is responsible for the supplication of instructions to make an enzyme called beta-glucocerebrosidase, wherein this enzyme, which is active in the lysosome, is facilitating the breakdown of glucocerebroside into a sugar or glucose in a simpler fat molecule called ceramide. Therefore, the mutation in this gene is accountable for Gaucher disease as it alters the amino acids present in beta-glucocerebrosidase, which then modifies the structure of the enzyme, prevents it from functioning properly, and or insert or delete certain genetic material in the GBA gene that may lead in the creation of a version of the gene that is abnormally short and ineffectual. In conclusion, the mutation in the GBA1 gene causes deficiency or lack of activity in the glucocerebrosidase inside the lysosome. The activity stated is the breakdown of the glucocerebroside, causing the buildup of toxic glucocerebroside lipids, mostly in the liver, spleen, and bone marrow. Now, for the inheritance of the Gaucher disease, since Gaucher disease is affected by mutations in the genes, that's a genetic disorder, which means that it can be inherited from parents to their child or children. According to the National Organizations for Rare Disorders, INC, the forms of Gaucher disease are inherited through autosomal recessive pattern, which means that a child must inherit both of the mutated recessive gene of the GBA from his or her parents. Using the Punnett square as seen in the slide, there is a 25% chance that the child will be able to have the disease, a 50% chance that the child is only a carrier, and a 25% chance that the child will not inherit the gene at all. The letters shown in the Punnett square are G, capital G and G, wherein the capital G corresponds to the gene that is normal and the small letter G is for the mutated gene.
So now we're gonna tackle about the signs and symptoms of disease. The signs and symptoms of Gaucher disease are a result of the progressive accumulation of Gaucher cells in the body. These are the most common symptoms of Gaucher disease: seizures, cognitive problems, eye movement disorders, enlarged liver and spleen, poor coordination, skeletal irregularities, respiratory problems, and blood disorders. The type and severity of symptoms can vary widely among individuals. Some individuals may not experience any symptoms until they are elderly, while others may develop life-threatening conditions during their childhood. Gaucher disease is progressive and if left untreated will become worse over time. Let's now move to the types of Gaucher disease. So there are three types of Gaucher disease and each has a wide range of signs and symptoms. Type 1, which is a non-neuropathic disease. Type 2, acute neuropathic. Type 3, chronic neuropathic. Type 1 Gaucher disease does not affect the central nervous system. It is also known as non-neuropathic disease. It is the most common form of Gaucher disease. Type 1 Gaucher disease does not affect the central nervous system and may appear early in life or adulthood. The signs and symptoms of this condition range from mild to severe and may appear anytime from childhood to adulthood. Most individuals with Gaucher disease type 1 may experience swollen belly due to spleen and liver enlargement, or hepatosplenomegaly, low red blood cell counts, anemia, which can cause fatigue and shortness of breath. They usually have low platelet counts, thrombocytopenia, which can lead to easy bruising and bleeding. Affected individuals may also experience bone problems, such as bone crisis. Patients often experience bone pain, including severe episode called bone crisis, resulting from reduced blood flow to the bones. Bone infarction or avascular necrosis. This condition occurs when parts of the bone don't get enough oxygen, causing bone tissue to deteriorate and die. This often leads to hip or shoulder problems, severe arthritis, and increased fracture risk. Osteopenia and osteoporosis. So Gaucher disease causes loss of calcium and mineral content in the bones. Spontaneous fractures. Due to osteopenia and osteoporosis, it weakens the bone, making them more likely to break. So bone fractures in patients with Gaucher disease can occur even without trauma. Joint pain. So it is common for patients with Gaucher disease to experience joint pain. So Gaucher disease can cause severe arthritis and joint damage, which can be permanent if the disease is untreated. Type 2 Gaucher disease, also known as neuronopathic Gaucher disease, is a neurological condition that affects newborns and babies and is caused by an abnormal accumulation of glucocerebroside in the brain. It causes serious medical problems starting in infancy. So most individuals with Gaucher disease type 2 do not live beyond 2 years of age. The symptoms first become apparent within the first 3 to 6 months of life. Gaucher disease type 2 signs and symptoms include early onset brain damage that is severe and rapidly worsening. Spleen enlargement or splenomegaly is a common first symptom that may appear before the age of 6 months. Affected babies can neglect previously learned motor skills and develop poor muscle tone. Hypotonia. involuntary muscle spasms or spasticity, and crossed-eye strabismus. Moreover, affected babies can also have trouble swallowing or dysphagia, which may lead to eating problems, irregular neck posture or folding or reflection, inability to gain weight and develop at the required pace or failure to thrive, and high-pitched breathing or stridor due to contraction of the voice box muscles or laryngeal spasm. Type 3 Gaucher disease is also known as chronic neuropathic Gaucher disease. It strikes children in the first 10 years of life. Gaucher disease type 3 has a later and more gradual onset compared with type 2. It has severity between types 1 and 2, causing the same symptoms as type 1 plus some neurological involvement. These individuals may survive into adulthood with a wide variety of symptoms. Major signs include seizures, skeletal irregularities, eye movement disorders, cognitive problems, poor coordination, enlarged liver and spleen, blood disorders, and respiratory problems.
Here are the pertinent information regarding the Gaucher disease. The local statistics shown that type 1 Gaucher disease has been reportedly the most common form affecting Filipinos. Based on molecular genetics and genomic medicine 2016, demographics presented a total of 11 patients were affected by Gaucher disease from 1999 to 2016 in the Philippines. On the other hand, international statistics suggested that Gaucher disease is more common around Western and Eastern Europe, specifically among Jews of Ashkenazi descent. Recent statistics shown that it appears in approximately 1 out of 500 to 1,000 of this population. Overall, it affects 1 in 50,000 to 100,000 people worldwide. In terms of mortality, as the world modernized throughout the ages, advancement in technologies serve as a support in the medical field. The rise of many tools, options, treatments, and even programs available decrease the mortality rate of Gaucher disease. Neonatal mortality rate shown 15 per 1,000 live births. Under 5 mortality or childborn dying before even reaching 5, rates shown 34 per 1,000 live births, while infant mortality rates, which is 25 per 1,000 live births. Moving forward to morbidity, Gaucher disease is one of the common lysosomal storage disorders triggered by the deficiency of the enzyme known as the glucocerebrosidase that will eventually give rise to mutations in the glucosidase beta acid gene. Researchers describe the disorder in 4 forms: type 1, type 2, type 3, and the most severe, perinatal lethal form. In essence, with the following information, Gaucher disease is not as prevalent as common cold as it can only be passed along the bloodline. Considering that it is a rare, inherited metabolic disorder, each pregnancy has a 1 in 4 chance that the newborn will acquire the disease even if both parents are carriers.
Now, for the treatment of the Gaucher disease. Along with other genetic disorders, there is no known cure for Gaucher disease. Fortunately, different treatments are available to control and prevent permanent damage and improve patients' quality of life. Patients diagnosed with Gaucher disease have individualized treatment, meaning depending on the type of the disease that each patient has, a specific course of treatment is applied to that patient. Early management of Gaucher disease is based on the distinctive symptoms of each patient. Treatment includes invasive procedures such as surgical removal of the spleen, hip replacements, blood transfusions, and transplants of liver and bone marrow. Even so, these procedures fail to identify the actual cause of Gaucher disease. Nowadays, the aforementioned procedures are last resort treatment because they are considered as high-risk approach. For the management of the disease, currently, revolutionary and FDA-approved treatments to treat patients with Gaucher disease includes enzyme replacement therapy and substrate reduction therapy. First, we have enzyme replacement therapy. This particular therapy introduces artificial enzymes intravenously to replace the deficient ones that causes symptoms of Gaucher disease. Now, these artificial enzymes, which are a modified version of glucose rubbersidase that is utilized in ERT, compensates for the missing enzyme that breaks down glucose rubberside. As mentioned earlier, the fatty chemical that build up in the body of patients diagnosed with Gaucher disease. Usually, intravenous infusions of the artificial enzymes are administered at an infusion center or at home, wherever the patient feels comfortable, every 2 weeks, and each procedure lasts for 1 to 2 hours. FDA-approved ERT treatments for Gaucher disease includes the following: imiglucerase, velaglucerase alpha, and taneglucerase alpha. First, we have imiglucerase. Imiglucerase, sold under the brand name Cerazine, is a recombinant DNA-produced analog of the human enzyme beta-glucose rubbersidase and is the only ERT that has a long-term efficacy and safety based in multiple studies over 10 years. Next, we have velaglucerase alpha, sold under the brand name Biprib. It is a hydrolytic lysosomal glucose rubberside specific enzyme and is used as a long-term ERT for patients diagnosed with type 1 Gaucher disease. Lastly, daliglucerase alpha, sold under the brand name Elelyso. It is a plant-made drug that is recombinant glucose rubbersidase and is used for patients with type 1 Gaucher disease. Next, we have the second FDA-approved treatment, which is substrate reduction therapy. Substrate reduction therapy works differently with ERT. Why is this? It is because it is an oral medication for Gaucher disease, and it partially blocks the body from producing glucose rubberside, unlike in ERT, which introduces artificial enzymes. Substrate reduction therapy, as mentioned earlier, has oral medications, and these include the following: miglustat and eliglustat. Miglustat, sold under the brand name Zavesca, is utilized as treatment for adults with mild to moderate type 1 Gaucher disease. This prescription drug is used also for a person who undergoes ERT and does not show signs of improvement. On the other hand, eliglustat, sold under the brand name Serdelga, is the only oral administered drug used for long-term treatment of most adults diagnosed with type 1 Gaucher disease. While SRT can inhibit the production of glucose rubbersides, it does not completely stop the process. What it does is it allows the body to keep the enzymes in balance. Now, to receive SRT, especially the drug eliglustat, the metabolic profile of a person must fall within the range at which the drugs that will be administered can be broken down. If not, this SRT cannot work properly and cannot block the production of the said enzyme. Aside from ERT and SRT, osteoporosis drugs are also utilized as part of the treatment, as they aid the body to build weakened bone caused by the Gaucher disease. And that is our report. The following are our references. Once again, we are Group 1 discussing Gaucher disease.